It's exciting to see a lot of faces back here again this year. Those of you that are new this year, we're glad to have you on board. Our conference this year is The Good Life Through the Aging Process, Caring for Our Elders. And I also want to make sure to acknowledge our distant sites that are on board with us again this year. So for those participants that are at our distant sites, we welcome you back to the conference again this year. And I would also like to, the items that you'll find inside that conference bag, you will all find a jump drive, or you should. If you're missing your jump drive, please let us know. Remember that in an attempt to be green, we don't give paper handouts at the conference. You can download the handouts for later use from our website, if you so desire. The other thing that you'll find in there is your conference evaluation. The evaluation form bag, and that is a survey. It's a brief survey that we have that was given to me by Dr. Statlander and Dr. Giles. They're two of our presenters coming in tomorrow, and they'd like to return that with your evaluation form. And I guess I need to say real briefly how the individuals at the distant sites will be getting their certificates. When we receive the sign-in sheets and the evaluation forms, we will mail your certificate to you. Let's see, what else do I have here? For those people that are attending on site here, lunch is going to be served in the ballroom adjacent to where we're at on the opposite side of the elevators. It's a buffet style, so feel free to, afternoon. You can also sit in there and eat and enjoy your lunch. So, let's see. I have a few other little housekeeping things that I need to make sure. We've had lots of questions about where the facilities are located. Facilities or bathrooms are located as you exit this room directly off to the left-hand side, for those of you that have areas. The other thing is we've been asked about parking validation. You can have your parking validated down at the main registration desk on the first floor of the conference center. And then I need to make an announcement that we have a participant in here that is missing her car keys. And she set them down on a table out there with multiple people signing up, and we're thinking that they might have gotten inadvertently picked up, or we're hoping. So it's a set of car keys are not being sent out to our distant sites, are being video recorded, and all sessions. Last thing that I want to remind you is that we end today, the last session, at 4:05 p.m. and Wellness, a Culture. And then the third one is Nursing Education, Research and Practice. She is currently the Executive Director of the Hartford Institute for Geriatrics, and she's also a Professor of Nursing at the New York University College of Nursing. Dr. Cortes has provided significant contributions to advance the health of people, particularly those with limited access to the healthcare system. Importantly, she has developed collaborative models with advanced practice nurses and physicians in traditional as well as non-traditional settings to enhance the care of American elderly population. Lighthouse International. That is a leading non-for-profit organization dedicated to fighting vision loss and helping prevent vision impairment. Dr. Cortes spent the initial phase of her career in nursing education at Hunter College, and then as the Director of Nursing Research and Information Systems at Columbia Presbyterian Medical Center. She was in adult ambulatory care. And then at Bridgeport Hospital as the Chief Nursing Officer and Senior Vice President of Patient Care Operations. Dr. Cortes has served on the boards of the International Agency for Prevention of Blindness and AMD Alliance International, and was appointed by the New York Fellow of the prestigious Robert Wood Johnson Executive Nurse Fellows Program. She received a Distinguished Alumni Award from New York University, where she completed her PhD and master's degree. She has her BSN from Villanova University, where she served on the Board of Trustees and was recently awarded the New York Women's Agenda 2011 Stars for exemplifying the qualities embodied in the NYWA, I always want to get that backward, mission to advocate and collaborate for interests of New York women in public policy decisions. Dr. Cortes currently serves on the board of Visiting Nurse Regional Healthcare System, the board of the National Accreditation Council for the Blind and Visually Handicapped, and on the I
was here at 7:30 this morning. Carter and I had everything working, and we have a glitch, but you can see it. I've got a little 1-inch screen up, and yay. And yay, I am so happy that I had an opportunity in my lifetime to come to this incredible country. You know, I come from New York over to Big Sky, And the terrain, the geography of this state is amazing. And I just, I congratulate all of you for living here in this beautiful paradise. We took the Chief Joseph Scenic Route back here last night for having me here. It really is a pleasure. This is a perfect time to be talking about the health and healthy aging and dignity of older adults, because this is the month of May. And most of you probably do know, but if you don't know, the month is the Older Americans Month, as we are looking at this huge mass of baby boomers coming into our fold of healthcare. And we look at these, and I'm one of them. And you know, what are the changes? There are changes. There certainly are changes. Our skin changes, things we can see change every day. Our skin changes, you'll see an issue for older adults. But if we remember never too old to play, we're keeping people alive, keeping people moving, keeping people thinking. So it's a very important theme for this year's 5 to 75. I like that. I like that. So we now have a new middle age. So we're looking at old second birthday. She parachuted out of a plane. People are doing all kinds of things. So it really, the number doesn't mean anything. Because if you look at patients who have HIV, or patients who have undergone severe stress such as homelessness, they're showing aging out. The slide I'm going to show you is going to be, I just need to give you a little background on it. There is a video, which I probably will have to get out, because there's some small print that I'll have to read. A advertisement, really, for who we are and what we do, and it was kind of a fundraiser also, as those of you who are in 501c3s know, we're always trying to find money. This picture of Edith McAllister in this poster that you will see, and it's Edith getting out of a pool. And in the center, there is a square. Now, I don't think you can. The nursing profession is the largest segment of the nation's healthcare workforce. Less than 1% of registered nurses are certified in geriatrics. In 1996, the Hartford Institute for Geriatric Nursing began working to provide the training and tools that healthcare professionals need to care for older adults. Healthy aging is possible. Here she is.
Well, much like I'm 91 years old.
Wait now, there should be sound
for
here.
At least 50 years, or maybe 45, 50 probably. And I swim every day, and have swum every day for 41 years. I started when I was 50, and now that I'm 90.
Exercise, always keep moving, because once you sit down, you never get up. If you want to live a long life, better get busy. So that is the story of Edith, and it's true. If she was running out the door to go to a board meeting. She's on 20 boards. And so she said, I'm dripping wet. I just got out of the shower, Tara. Can you call me back in 2 hours? So that's what I did today. The simple idea that is transforming healthcare, and that is the focus on quality of life, helps medical providers see the big picture and makes for healthier, happier patients. And what you see here is a team, an interdisciplinary, interprofessional that are so important. So it's a matter of remembering who is the interprofessional team and who is the healthcare team, and the patient and family are there. But the focus on quality is where we are looking today in healthcare. What is quality? And what is quality for, it's different for different people. And I know that we have a talk later on today, life. And certainly as we work with more and more people who are aging, quality of life and end-of-life care becomes a very big issue for discussion. and I'll mention it a little bit further on here in my talk with you. But I think that a lot of people also look at old age as terminal. And it's time to, and you know, he's 94, he gets a little cantankerous when he doesn't feel well. And the doctor was there and said, just leave him in bed, for heaven's sakes. Don't make him suffer. Let him stay in bed. We can get him a bedside commode, and he can just stay there. And I said, well, he doesn't need a bedside commode because he's got a colostomy. Those older people, they sit in bed, or they sit on the sofa. They don't feel well. They sit on the sofa for a couple of days. It takes almost 4 days in a 90-year-old to get them. Most of these statistics you've seen before, and you might know them. In 2011, 65 or older, reported in Washington to reduce the number of readmissions by our Medicare patients. People 85 and older spend about 5 times more on health care than people who are 45 to 55 years old. And that's when that end-of-life decision-making and concerns of quality of life become very important. And do we address those enough in primary care situations? Getting skin breakdown in the hospital. A lot of this has been addressed in the last couple of years. A lot of initiatives on quality in the last couple of years have decreased the never events. Too many. Older adults are more susceptible to those never events, and we know that. You put a urinary catheter, so often don't want to get the patient out of bed to go to the bathroom, so you put the catheter in and the patient ends up with a UTI. Regimens often result in delirium and cognitive decline, something that we don't pay attention to. I had, my mother she died when she was 92, but she was admitted to the hospital a couple times in those last 6 months of life. Came home one Saturday night without any of the medications that she'd gone in on. And some of them had really controlled her blood. So, patient advocate, I called the doctor's office. And of course, I got the answering service who got the doctor. His answer to me was, this is not a Saturday night question. Call the office on Monday morning. Well, he tangled with the wrong person. I said, that's not acceptable. I said, this is a woman who's been on these medications. So I went the full road with him. And P.S., I got off the phone with him, and she was back on all. You know, you make rural New York look urban. And I recognize and realize that network involved must be very, very important, because sometimes that's all they have. And none of you are that close in proximity. So it's important to keep that. We know there are many good ones, and we know many of them are trying to avoid malpractice suits. So that has also, I think, increased the number of tests that are done, because many doctors will say, well, if I didn't do that test, they would have told me the patient had it, that we have going on from treat the sickness to prevent the sickness and promote health. Healthcare costs in this country continue to soar, although we held down a little bit last year. They're about 17.6% in the other country. We rank 20th in life expectancy. And unless we do something to prevent the growing problem of obesity and diabetes, that number is going to get even more dramatically worse. We rank 7th in mortality in cancer, which really amazed me, and this is when you need that test. And now, you know, we're looking at what is the evidence base to do a mammogram or to do a retooling for an aging America was a call for action. And I look at your work out there, the posters that are around out there, and I'd say Montana has answered this call. I see you've got being sponsored by the Comprehensive Geriatric Education Program grant. This is wonderful. So people who have gotten together and created opportunities to get resources to the state to develop the geriatric capacity in the workforce is really a tremendous credit to the people who are doing that. Because electives in geriatrics, our docs are not prepared. And nursing programs, 25% of bachelor's programs in nursing offer specific content in the care of older adults. Now, a lot of them say, well, it's integrated in. Well, you know, I often say if you integrate it in, it's integrated. Those of you in education really need to provide a very concentrated core of geriatric knowledge in those undergraduate programs? What are the geriatric syndromes? What should you be looking for? What makes that 85-year-old patient that you're seeing, whether it be in primary care, whether it be in the hospital, or whether it be in a nursing home, what makes them different than the 50-year-old or the 6,000? Almost 7,000 now. And that number, you see, instead of increasing, is going down. Years old, but just by the time you get them undressed and get them onto the table and talk to them, it's an hour. Have one physician prepared in geriatrics to care for 10,000 people. Certainly not enough. Geriatric knowledge. Aha, the nursing workforce. Potential, large potential here. First of all, again, the future of nursing, IOM, one of your papers this past week on the fact that we are increasing the number of nursing graduates, but we still don't have enough to meet the need for the healthcare, for healthcare in this country. Money's awfully hard to raise these days. Those are the kinds of resources, though, that are so important, because that's the community. And without mobilizing and certainly here where we have the wide open, beautiful spaces, it's a heck of a lot harder to get access to health care. But I'm here to tell you that even in the very, very, very populated places like Brooklyn, New York, which has, we have people there who don't have access to care, because they can't find a way to get there. And again, that's the importance of the community. So whether you have very populated areas or whether you're very far apart, we don't have people getting the proper access to care. So our challenge is, how do we make that happen? How do we assure that people do have access to care? And finally, the scope of practice. How many out here that advanced practice nurses can be our wave of primary care providers, particularly for older patients? We don't have primary care providers into that. They're all going into specialties. Primary care is best given by someone who understands the whole patient and looks at the whole patient and focuses on the whole patient. And that's what an advanced practice nurse does. So I think that this is a tremendous hope for us as we move forward. The recommendations that came out of the bachelor's degree, advanced